Get my daughter to college in San Francisco. I was on my way back when I get a call from my sister-in-law. Bakersfield has shots. We're going right by there.
I figured this would be the earliest opportunity I had to get a shot before they open it up to everyone else.
As we've been telling you throughout the morning, there's been a surge in out-of-town residents driving hours, in some cases, just to get a COVID-19 vaccine at Cal State Bakersfield. Those 16 and up are now eligible and current ahead of some other California counties, including the neighboring county, Los Angeles County. This morning, we're continuing our in-depth coverage on this developing situation, and we're joined now by Dina Madden, Chief Nursing Officer with Kaiser Permanente, to talk about this situation. Thank you so much for being here this morning.
Thank you so much for having me.
So let's jump right in. Can you tell us who exactly are we now seeing coming here to Bakersfield to get a COVID-19 vaccine?
Well, I want to start by saying that primarily we are seeing Kern County residents. We are seeing some that are coming from out of the area, and our focus is really on ensuring that our residents of Kern County are the first ones to be vaccinated.
And that's a really important note to touch on there, because we just heard from two men who don't live here coming here to get a vaccine. Obviously, we want to make sure that the people living here are vaccinated. Is certain priority being given to those people in order to make sure that they get their shots?
Absolutely. We are really encouraging the residents of Kern County to make sure that they go on to My Turn and make an appointment. All of our appointments are a priority. And so we are accepting walk-ins. And so when we have those coming from out of town and we have vaccine available, we will offer it to them. It is state-provided vaccine. However, we are prioritizing those with appointments and those in Kern County.
And my understanding, please clarify if I'm wrong on this, but my understanding is that people from out of town aren't able to make appointments here. They can only access it by walking up to a site.
That's correct. So
in that case, obviously we need to get shots into arms. We're welcoming those people. Can you just kind of clarify the messaging? Because, numerous Los Angeles TV stations came up here yesterday to cover this. People are going to be, tuning in this morning in other parts of the state, and they're going to see, that Bakersfield is giving out these vaccines. What would you like to say to those people?
Well, our goal really is to get shots in arms. We want to do our part in ending the pandemic. As long as we have appropriate amounts of vaccine available to our residents of Kern County, and we have additional available for walk-ins, we will continue to offer it. But if we get to a point where our availability of vaccine or the amount of appointments available become less and less because we have more Kern County residents making appointments, then that will decrease the number of available walk-in appointments for those out of area.
Now, I heard an interview yesterday with David Womack, the Senior VP with Kaiser Permanente, and he said that the rates here for vaccinations in Kern are actually a lot lower than other counties. Can you maybe explain the reasoning as to why we're seeing less people here actually decide to get their shots?
Well, I think there's many reasons. I think one of the primary focuses for us is that we have a lot of communities that are underserved and may not have all of the information that they need to determine that they want to get the vaccine. So we actually are involved in several outreach opportunities. We're partnering with Kern Community Foundation to outreach many of the underserved. In fact, this coming Sunday, we're actually going to be partnering with our consortium partners that are also partnering with us at the vaccination site. That's Adventist Health, Bakersfield, as well as Dignity Health Hospitals. And we're going to be going to the People's First Baptist Church and delivering vaccines there. We know that there are a lot of underserved and communities of color here in Bakersfield that really we're trying to get the word out to them about the vaccine and make it more accessible and available to them.
Yeah, it's certainly so important to do that. This week, eligibility was expanded here to allow those age 16 and up to get their COVID-19 vaccines. Are we seeing a lot of those, younger people go to the vaccination site?
We absolutely are. That's actually a very good majority of who we're seeing at this point in time. Although we are seeing still some of the older populations, I would say a good majority of who we're seeing at the vaccine site are the younger now.
Okay. And are you anticipating a surge, in the coming days with more people hearing that the vaccine's eligible here?
We are. We do know that the word has gotten out. We're also looking forward to next week when on the 15th, all of California will open up to 16 and older. So, we realize that there's this window of time that people may be coming to Kern County. We also anticipate that there will be people going to be vaccinated in other counties as well here very soon.
And my last question for you this morning, supply, how is it?
So far, we're doing well with our supply. That could change at some point in time, but at this point in time, we actually have a good vaccine supply and want to continue to get that into the arms of our residents in Kern County.
Perfect. Well, thank you so much for joining us this morning, and good luck with those vaccination efforts.
Thank you so much for having me.